Lupus is a master of disguise. It mimics, hides, and confuses even the best doctors. But what if your body was fighting itself, and you had no idea why? What if the biggest battle of your life was invisible to everyone around you? Today, we're pulling back the curtain on one of the most misunderstood diseases, because knowing the truth could change everything. Alright, so let's talk about lupus, a condition so sneaky it could win an Oscar for best impersonation. This autoimmune disease basically tricks your immune system into thinking your own body is the enemy. The result? Inflammation, pain, and potential organ damage. It's like your body's security team got hacked and is now attacking the VIP section, your vital organs. And just to keep things interesting, lupus isn't a one-size-fits-all deal. The most common type, systemic lupus erythematosus, can go after your skin, joints, kidneys, heart, lungs, and brain. Because why settle for one target when you can have them all? Then there's cutaneous lupus, which primarily affects the skin, often triggered by sun exposure. So imagine getting a rash just because you dared to go outside. Drug-induced lupus is a temporary version caused by certain medications, kind of like the demo version of the disease that goes away once you stop taking the offending drug. And finally, neonatal lupus affects newborns but usually resolves without major issues because babies have better things to worry about, like learning how to hold their heads up. Now, symptoms? Oh, they're as unpredictable as your Wi-Fi signal. Some people get the famous butterfly rash, others deal with extreme fatigue, joint pain, fever, hair loss, and sun sensitivity. And since lupus symptoms love to cosplay as other diseases, doctors often struggle to diagnose it. This is why it's called the Great Imitator, which, let's be honest, sounds like a magician's stage name. So what causes lupus? Well, we don't exactly know. It's likely a mix of genetics, environment, and hormones. It's way more common in women, especially during childbearing years, suggesting estrogen might be involved. Other triggers? Viral infections, UV light, stress, and certain medications. Basically, if lupus were a person, it would be that one guest who crashes every party uninvited. Chapter 4, and let's talk about diagnosis, because there's no single test that screams, "Yep, you've got lupus." Doctors rely on a mix of symptoms, medical history, and lab tests, with blood work checking for anti-nuclear antibodies, or ANA, which most lupus patients have, but so do some completely healthy people, just to keep things confusing. Additional tests help narrow it down, and sometimes imaging scans are used to check for organ damage. In short, getting diagnosed with lupus is like solving a medical escape room. So how do you treat it? Well, since there's no cure, the goal is to manage symptoms and keep the immune system from going rogue. NSAIDs, like ibuprofen, help with pain and inflammation. Corticosteroids can calm things down but have side effects if used long-term, and anti-malarial drugs like hydroxychloroquine are surprisingly effective. Yes, a medication originally used to fight malaria is now a lupus warrior. More severe cases might require immunosuppressants, which, as the name suggests, tell your immune system to chill out. And for cutting-edge treatment, biologic therapies like belimumab target specific immune pathways, offering more precise symptom control. Living with lupus means dealing with unpredictable flare-ups and chronic fatigue that no amount of coffee can fix. Even simple tasks like grocery shopping can feel like running a marathon. Sun exposure? Often a no-go. That's why sunscreen and protective clothing are a must. A balanced diet packed with anti-inflammatory foods can help, and while exercise is great, it's a delicate balance when your joints feel like they've been replaced with rusty hinges. Stress? Another big trigger, which is why yoga, meditation, and sleep are all part of the survival kit. Despite all the challenges, there's good news. Advancements in research are improving lives, early diagnosis is key, and with the right treatment, many people with lupus live full, active lives. But misconceptions still exist. No, lupus isn't contagious. And no, it's not just being tired all the time. The more we understand, the better we can support those who have it. So what's your take? Have you or someone you know faced lupus firsthand? Let's talk in the comments. If you haven't subscribed yet, now's a great time to do it. Support the channel, take care of yourselves, take care of your loved ones, and I'll catch you soon in another video.